Hi everyone, it's Dr. Rich here from Salvatore Dental. Today I want to touch on emergencies. What's an emergency? What should I do? And pretty much everything involved, so stay tuned. So what qualifies as a dental emergency? I'd have to say the one thing we want to pay attention to is any kind of symptom where we're having some extreme pain or something just broke and it seems like it's something that could be serious. We've probably seen on the news before that, a dental emergency can lead to, unfortunately, very tragic events. There have been cases where, a swollen tooth that's not being taken care of, that's infected, has closed an airway, had other issues, led to other infections, putting people in the hospital or worse. We've had patients here, even last week, a patient came in and he said that he had an infection so bad in his tooth, he was at the hospital for a week on antibiotics. So if you have any sort of tooth pain or you're not seeing a dentist on a regular schedule, I would say definitely go see a dentist. Even if you don't have pain, it's great to see a dentist. Unfortunately, once you have pain, it shows us that the problem has progressed pretty far. We have patients who have cavities and issues that are asymptomatic, meaning they don't hurt yet and they still need to be fixed. If your tooth actually hurts, it means that it's a little bit bigger of a fix. It's gonna be more time and money and possibly some surgery. So the best thing to do is jump on seeing a dentist for regular care right away. So one dental emergency we get quite often, especially with kids sports, is what happens if I lose a tooth or a tooth gets knocked out? It's a great question. If it's an adult tooth, meaning it's not a baby tooth and it comes out and it looks kind of clean, meaning that the whole tooth came out with the root, it's not broken or anything like this. The best thing to do is, of course, right away, call a dentist. And I would take that tooth and put it in milk. Sounds kind of strange, but putting the tooth in milk right away will actually keep some of the vital cells on that tooth. And it's actually possible, if you can get to a dentist quick enough, to reimplant the tooth. Another kind of crazy thing you could do if you don't have milk is to put it in your mouth. You could have it kind of sitting by your cheek, have the saliva around that tooth, and you're honestly buying time until you see a dentist. That's definitely one thing you can do if the tooth completely comes out and is clean. If it's a baby tooth and it comes out, we don't do the same thing, we just kind of let it be. A lot of times, other things happen where a tooth breaks, it doesn't come out all the way and it's kind of displaced. Same thing, that's definitely an emergency, so I would give an emergency dentist, a 24-hour dentist, a call. Because oftentimes what can happen is we can reposition the tooth, but an x-ray and things are definitely needed in that situation. So can you treat a broken tooth in one visit? A lot of times a broken tooth does take a little bit more time than one visit, just because if it's broken, it might need quite a big fix. So what we like to do here at Salvatore Dental first is put out the fire, meaning we want to make sure you're out of pain, there's no further damage that's happening, and we have a solid plan where we know that we're going to have a solution that's going to be long-term. Here at our office, we do have ways to fix teeth with our one-day crown procedure, where we technically can fix a tooth from start to finish in one visit or one day, but it's always difficult to kind of know exactly what's needed. A lot of times it might be that, it might be, unfortunately, a surgical removal. There's all these different types of things. So what we try to do is get our patients in, we diagnose, get the patient on the pain, and then set up or create a correct sequence to get a nice long-lasting solution. Patients often wonder, how do we handle dental emergencies after hours? Here at Salvatore Dental, we do have an emergency line where if there's a problem, you can definitely give us a call and it gets forwarded to someone's cell phone, or we get a text or an email. There's a whole network or system. But a lot of times we're only able to really call an antibiotic over the phone if that's appropriate, and kind of just have things triaged until the next day. There are places that are open 24 hours locally, and then there's also urgent care or the ER. I always tell patients, it's hard for me to diagnose over the phone or email. Really, we want to make sure that things are being looked at appropriately. So I do have patients that sometimes do go to urgent care or the ER if there's swelling. The crazy thing with swelling with a tooth is that you can start in the tooth area, but we can also shift towards your throat. People can have trouble breathing. So it's a very delicate and potentially dangerous situation. My advice is to always play it safe, making sure that you are safe and doing what's necessary. And then when we're back in office, we can get you in, take the appropriate x-rays, and diagnose and treat everything that's needed. Patients want to know, what can I do to manage tooth pain at home and until my appointment? Tooth pain is very difficult. I always say over-the-counter medication like Tylenol or Motrin is really good. Ice, believe it or not, is a great adjunctive treatment, icing the area, and then also placing a call to your dentist or a new dentist to try to see, if you can get in or if there's antibiotics that can be called in. A lot of times, some of the pain is from when you're laying down. At nighttime, it starts to throb and ache. So if you can sleep kind of elevated, maybe in a recliner, that would help as well. Tooth pain is difficult, especially when you're home. There's not really great ways to treat it. There are some over-the-counter topical numbing jelly and things, but it only does so much. So I always tell my patients, potential patients, just people in general, you want to have regular care at the dentist, making sure that these emergency situations do not pop up, because they never come at an opportune time. And you really want to just keep up with your medical and dental care. So if you're experiencing any dental pain or any twinges or anything just doesn't feel right, or if you just don't have a dentist at all, I'd encourage you guys to give us a call here at Salvatore Dental. We're definitely accepting new patients. Our phone number is 518-899-6068. Thank you so much.